Hi, everyone. This is Wendy.
And Amara.
We are founders of the Oregon Pain Action Group, and this is an advocacy call to action. So we're really hoping that everyone can get involved in this and we can really make an impact on the draft report that we're going to be talking about today. I want to give you a brief history about this bill and kind of why it's needed and how it came to be. Senate Bill 607 was a bill that Amara and I have been working on for years with a representative. We originally tried to get legislative involvement on a bigger scale, but because of how things happen in the legislature, we ended up with Senate Bill 607, which is just a study bill, but at least it's something that can open the conversation to the plight of the pain patient. Senate Bill 607 is a study of the Oregon Pain Management Commission, which was founded in 1999 to protect pain patients and to be a voice for them. But unfortunately, they have not been fulfilling that responsibility. And so that's a big reason why we have not had the protections in Oregon that we could have had if the Oregon Pain Management Commission had been active as they should have been. But we still hope that even though Senate Bill 607 is not the bill that we really wanted it to be, that maybe we can make it impactful with your comments and with just the support that we want to give to make things as good as we can with this bill, and hopefully bring attention to our struggles.
Yes, absolutely. And the Oregon Pain Management Commission is really a state commission that was developed to help the people in Oregon who live with all sorts of pain. So from moderate to life-impacting disability pain. We've had one common theme in that we want balanced representation. So we need to try to act upon this bill that did take Wendy and I about 3 years to get approved, and the governor signed it in 2023. So now the draft report's been created, and we're going to just go through the draft and give our suggestions and input on what you could possibly do for your comment. So we'll start by just reading the bill, and I'll try to put the images up on screen as we go through. So, a bill for an act relating to the Pain Management Commission be enacted by the people of the state of Oregon. Section 1, the Oregon Health Authority shall study the membership of the Pain Management Commission. The authority shall submit a report in the manner provided by ORS 192.245 and may include recommendations for legislative changes to the membership of the Pain Management Commission, to the interim committees of the Legislative Assembly related to health no later than September 15, 2024. And then it gets repealed January 2nd, 2025, so it's just a very short acted bill. But I'd like to focus a little bit on the way it's worded. So we do know, and we'll go into that in a minute, that the authors of the bill are actually the staff of the Pain Commission itself. So keep that in mind when you're reading that bill. The Oregon Health Authority shall study the membership of the Pain Management Commission. Not the Pain Management Commission shall study the membership of the Pain Management Commission. The authority shall submit a report in the manner provided by ORS. Not the commission shall submit a report in the manner provided by ORS, but that's what's happening. The commission is actually doing the report. During the hearing for SB607, there was discussion about why this study is necessary and why it is important. Former representative and advocates stated the reasons for the bill were because patients felt unheard, wanted equal representation on the commission, balanced membership for differing ideologies for pain care, to ensure no conflicts of interest, inclusion of patients and advocates who represent non-addicted pain patients to be included on the commission and their voices and concerns to be heard, and for the commission to work towards solutions and answers of the patient's concerns, and that they fulfill the requirement of reporting concerns of patients to the legislature. No reports have been done to the legislature since 2019. Keep that in mind, despite patients and advocates requesting for the reports at all commission meetings.
And they also are supposed to be giving a report to the governor and making the governor aware of the concerns of pain patients. And we are not aware of any reports that they've ever done to the governor. So I'm not sure, maybe in their inception back in 1999, they probably had something in place to do that. But to our knowledge, that has not been done in, as long as we've been involved in advocacy, which has been, a decade now.
Yeah.
Okay, so Amara, could you show slide 3, please?
Yeah. This is the email notification that went out for public comment.
Yeah, so this was as Amara said, this is the email notification for when they released the draft report for us to read and comment on. They emailed us at 5:05 p.m. on June 27th, 2024, and they said that the commenting period is going to close July 22nd at 8 a.m. So we're a little bit curious about how long they gave us to comment, because typically most comment periods are 30 days. And, we looked around on the OHA website and also some other state websites, and the standard commenting period for initial reports seems to be 30 days for everything that we can find.
Yeah.
But this report, they're only giving us 24 and a half days, since they published it after business hours on the 27th, and the deadline is 8 a.m. on July 22nd. So anyway, we're just a little bit curious why we weren't given 30 days, and we're hoping that that is not, another example of the commission silencing voices that may differ from their position that they promote. We're hoping that it's just some kind of oversight and not intentional. Can we get slide 2, Jason's email, please?
Yes.
One of the questions that we had, the bill says that the Oregon Health Authority is supposed to be responsible for authoring the report and conducting the study. And so, we were initially, when this was worded that way in the bill, we were concerned about exactly what department would be responsible for that and how it would go. I had asked that it would be the director of the Oregon Health Authority, but that never got put into the bill. So it just says that the Oregon Health Authority shall study it. Most of the time when you have a study or an evaluation or an audit, it's conducted by an objective third party to ensure that there's impartiality and that the study is, or the evaluation is, a quality, unbiased report. But that isn't the case. It's just supposed to be done by the Oregon Health Authority. Many times during the House and Senate hearings, it was stated that the OHA would evaluate the report on the commission to assure balanced membership for all the reasons that we've discussed. Never once was it declared that the commission or its staff would be investigating itself.
Recording.
To better understand how an applicant goes from applying to being appointed, we will give you just a little brief understanding that we have, which is that when an applicant applies to the commission, their application is first accepted or denied by the commission chair, vice chair, and its staff. If they are accepted through that initial screening, then they are transferred on up to the Oregon Health Authority, where they potentially get some other screenings and some other management approvals. We don't really know about that. We'll talk more about that later. But the draft report is a little bit concerning to us, because the whole point of Senate Bill 607 is to investigate the membership. And since the membership is appointed by the staff of the commission and the chair and possibly the vice chair of the commission, if we're studying the membership, then we're directly studying the job that the staff and its vice chair and chair are doing in appointing members. So that concerns us, because it appears that the commission is evaluating themselves. So even though the draft report, never once says that the commission or its staff and his supervisor have authored the study or the report, it has been confirmed to us that they are the authors. A third-party neutral and partial auditor or evaluator didn't study the membership of the commission. The commission studied and reported on itself, and this creates a huge conflict of interest, which was the whole entire big part of why we wanted the membership studied, is because we're concerned about conflicts of interest.
Yeah.
If the study reveals that the membership was not balanced and needed adjustment, then the commission is basically criticizing themselves. If their study reveals that, they're basically criticizing themselves. It is inconceivable that Senate Bill 607 could have intended to create this conflict of interest when the bill in part was to ensure that there were no conflicts in the membership. In my opinion, this is really where the report seriously begins to erode, and it nullifies the entire process and the result of the study. We asked for the study because we felt there were inequities within the membership stemming from the selection process of the membership, among other things. If we are unable to have an equitable, neutral third party doing the report, then the report is invalid and serves no purpose. The legislature couldn't have intended the report to be handled this way. And why isn't the authorship transparent in the report? If you look at the draft report, it doesn't say anywhere on there that it was authored by the people who actually authored it and conducted the study. If you look at all the pages, the only conclusion that anyone would come to that didn't have the knowledge that we have is that the Health Policy and Analytics Division was the one who created the report and who authored it, but that's not the case. Yeah. This is not only a transparency issue, but proof of the exact issues that we are trying to solve by requesting the study.
Email address that public comment goes to.
Right.
So right here you can see, I'm going to bring up the slide, and this is the email that went out for public comment. The email is pmc.info and it just goes on with the state email address, but that goes directly to the staff of the commission. And again, we want to reiterate, the staff has had major involvement in picking the members, and there's a lot of issues that come from the staff person. So because there is no neutral party conducting this draft report, and again, the staff wrote the report, and the public comment associated with it, we are forced to comment on this draft report to the exact group who has ignored us for years, while we repeatedly gave public comment and requested their assistance in protections and promoting the pain patient's perspective, but instead we were ignored. The only reason we pursued the bill, we spent 3 years, is because the commission wasn't responding to the needs and voices of those living with painful conditions now. And we are supposed to continue to do the exact same thing that has not worked in several years and to contradict their report to them, since they basically say there's no issue, which is exactly what we expected. If there were no issues, we wouldn't be here right now. They've completely missed the heart of the study and once again dismissed, ignored, and devalued the population they were created to serve. Then moving on, if you can look at the slides on the screen, moving on to page 3 of the draft. The first assertion is incorrect, but it also shows one of the issues that we've been trying to address for a very long time. The report states that the primary responsibility of the commission is to develop a 1-hour training in pain management.
Slide 8, with the primary duties of the commission, we can see that the training module, the 1-hour training module, is not listed under the primary duties of the pain commission. And so according to ORS 413.570 and 413.572, the primary responsibilities of the commission is to develop pain management recommendations, and those recommendations were supposed to be based on what they'd heard from pain patients and their concerns. Develop ways to improve pain management services through research, policy analysis, and model projects, and to represent the concerns of patients in Oregon on issues of pain management to the governor and to the legislative assembly, which hasn't been done, as we said earlier, since 2019. And on slide number 5, Mara, if you're able to put that up, it shows that the last report to the legislature was, in fact, in 2019. And we are unaware if there's ever been a report to the governor, like we were talking about previously. The primary duties, actually all the duties of the commission, were supposed to stem from listening to the patient's concern and seeking to help others understand the challenges of living with chronic painful conditions. It was to be a pro-patient commission that gave patients a voice. You only have to read a few of the commission missions and bylaws to see how deeply they believed in the patient's voice. I'll read some of their bylaws just for an example. One of them is they wanted to value the pain patient as an integral part of the pain management team. Work to empower pain patients through education and better access to care. Seek to be creative in their strategies to improve pain management in the state of Oregon. View pain patients as a valued member of society and encourage them to be heard. Seek to gain new insight by encouraging feedback from all interested parties and through the sharing of information openly and honestly. You know, one thing that really jumps out to me there is the sharing of information, because as someone who has commented many, many, many times at the Oregon Pain Management Commission meetings, I have never had a sharing of information, conversation, or anything like that when I've attended the meetings. It would be amazing to feel heard and understood and important and as an integral part of the commission meetings. That would be amazing. It would be amazing to have my comment and have somebody interact with me based on that comment to try to better understand what I'm saying and my perspective, and to take those comments and that feedback and make them a part of something that changes things for pain patients. Because during this entire basically chronic pain crisis that we've had since 2014 and before, we've been saying the same thing over again. We've been allowing our voices to go out there to try to let everyone know the struggles that we've had, but nobody's heard them. But this commission was created to hear them and to make sure that other people heard them, and they didn't do that. So we need to find a way to bring the commission back to where it was intended to be, so that those protections are afforded to those who need it, to the pain community.
I remember a past meeting I went to that actually a public person came with me that was one of the original members of the Pain Commission, and he left within 20 minutes of that meeting because he felt so unwelcome there. It really puts it in perspective. If one of the original members was so offended by the way he was treated, he left early that meeting. I ended up sticking it out, but again, you're limited to 2 minutes to 3 minutes. There's no Q&A. There's no interaction with the community. But if we're going to go on to the next slide, this is slide 9, additional duties of the commission. The fact the commission has downgraded their primary responsibility of being a voice for patients and basically advocating for them, and elevating the responsibility of creating a pain module, which completely lacks the concerns of the patients and the voice and the involvement from patients, and lacks any focus on our primary obstacles, shows the heart of the problem we've been experiencing for years, which led us to the legislature SB607. The commission is no longer focused on its primary purpose, mission, statements, or bylaws. The fact is that the responsibility of the commission to develop the 1-hour training module is listed under additional duties and is not the primary goal at the commission's inception. During commission meetings in the last few years, we've heard members voice the desire to eliminate their primary duties, including the worry about, this again in favor of the creation of the education module. One of those was taking the voice of the community to the governor and legislature. That was attempted to be removed. Thankfully, it wasn't. But that was never the intention in 1999 when the commission was created, and it is not profitable now. But it never goes to show the current membership disregard for the people it was created to serve.
Next, we'd like to talk about the membership in the draft report. On page 4, something that jumps out at me is that about middle of page 4, it says members serve 4-year terms and are eligible for reappointment. And then past practice has been for members to be limited to 2 4-year terms. But they don't have the term limit anymore, or at least they don't list it here. So that's a concern for me, because we want to object to that. Without new members and new voices bringing new ideas and fresh thought, a group like this, especially when it seems to limit the applicant based on their alignment with existing ideologies, is in danger of a version of regulatory capture.
Yes.
The legislature requires 19 members of the commission, but the draft says there are only 13 members. But Appendix A in the same draft report that they have here only lists 12 members. So I'm not sure if there are 13 or if there are 12, but certainly not 19. And like I said above, we definitely need term limits. That's something that we feel strongly about. There are supposed to be 2 seats reserved for legislative committee members, but we've never seen both seats filled, and neither have any seat be filled by an attending member. Not since we've been working with the commission over the last several years. Yeah. Also, there's no members currently on the commission that are pain patients or advocates representing other pain patients. According to the missions and bylaws and the intent of the bill that created the commission, patients and advocates who represent other patients in pain would be critical seats to fill. Their voices are the ones that are supposed to be promoted. So it's really concerning to me that it isn't essential in the commission to have the pain patient's voice that is living with pain. The commission normally appoints new members in July. Can you show slide 6, please, that shows that? Yeah. And since no members from the pain or advocate population has been introduced and we are past July 1st, will it be another year without representation for the group who was acknowledged to be a critical component of the commission, whose perspective is supposed to be supported and presented by the commission? We've gone a year without a member on the commission with this experience. With our current medical climate and ideology slant, it is imperative that the pain patient or advocate member represent non-addicted pain patients and not be affiliated with any addiction groups. Given the purpose of the commission and the bylaws, it seems to me that this is one of the seats that must be filled. The reason that I mentioned the non-addicted pain patient, I'll discuss that a little bit more later, but we feel that is crucial. And like I said, we'll discuss it later. But the commission opened up applications a couple months ago, and some people that we know from the pain and advocacy community have applied, and in the past they have applied, but the seats still remain vacant.
And next we're going to show a slide of the draft on scoring. So this again was included by the staff of the commission, showing how they score applicants to be members. Again, these are volunteer members, but they're still very critical seats. Looking at the scoring, it seems there are inequities for patients and advocates, and possibly the public member, since they usually lack a professional role in healthcare, which is required to answer questions 13 and 14 and receive points for those questions. Also, the draft states that once the applicant are screened by the commission leadership, which includes the staff member, the accepted ones are put forward. Then they are reviewed by at least 3 layers of management prior to appointment by the Oregon Health Authority director. We would personally like to ask who these layers are and what the specific process is, because we have previously heard a different process and would like clarification. So again, feel free to bring that up as one of your points. These are all just suggestions. And then we have moving on to page 6 of the draft, it says there are 3 changes that are recommended by the commission, but then goes on to only list 2. In their second suggestion, we would like to stress that there are 2 categories: members of the public, and members from the pain advocate community who represent pain patients. In this section, the draft almost seems to merge these two separate groups. Though the member of the public should also have relevant experience or insight into pain in order to contribute to this pain commission, the essential role of the pain patient and advocate who represent other pain patients cannot be stressed enough to be required on this commission, which seeks the voices and perspective from this group. We ask that it also is stressed that all the members of the group be focused on pain and not addiction, and that the public members and pain patient advocate members not to be associated with addiction groups. That's the least that we can ask. We've seen the addiction focus swallow the focus of the pain commission. Real harms have come from this. Here we're going to recommend some changes that these are just our ideas. Feel free to use them or change them. Number one is conflicts of interest need to be included in the individuals who create or benefit from their own pain-related businesses because of their position on the commission. There needs to be a big emphasis on screening for conflicts of interest.
And another one of our recommendations that we have personally is that members be balanced in their ideology about pain. There is some communication about balanced membership in the commission, but it's usually focused on a balance of professional job titles or whatever. But we really think the balance needs to be put in a different place. Mm-hmm. And that balance needs to be because there are different ideologies about pain, and we've seen really just one ideology promoted in the commission, and we really need balance for that. Also, the members in the pain and advocacy community who represent other patients should be required on the commission. It shouldn't be just a nice thing they'd like to have. It should be a requirement for those seats to be filled on the commission. And since we know there have been applicants that would fill that role that just have not been chosen, we know there are options there. It's not like nobody has applied.
Yep, absolutely. And another one is we ask that the members' focus return to their primary responsibilities, bylaws, and missions, and away from the pain module. That, again, has been overwhelmingly their focus.
Exactly. And we ask that the commission eliminate misleading terms and fringe science, which gives incorrect impressions. One such term is pain science. Pain science is not based in science and is not nationally accepted. It is a term that comes from physical therapy that has basically been used over and over recently, and it gives an illusion that it's talking about science related to pain when it's not. And that's very misleading, and it can lead to a lot of harmful things for patients, especially if people believe it's rooted in science.
Absolutely. More transparency with the process for appointing new members, as we've discussed.
And we really need the commission to submit regular reports to the Legislative Assembly talking about things that are concerns for us, like abandoned patients and how to get care for some of these very, very complex medical conditions that patients are having, and they are abandoned and on their own trying to deal with these things. That's a crisis. Mm-hmm. And the Legislative Assembly needs to know about that, and we need to work towards solutions to help patients in all of the areas of needs that they have.
Just to reiterate what Wendy pretty much said was just they need to begin to submit reports to the governor, abandon patients, work towards solutions to help these patients. This should be part of the commission's work and should be a major part right now when we're in this crisis.
And we need to continue to submit to the legislature and begin to submit to the governor, because these mm-hmm. were put into the document that created the commission because it was important. It was an important way to get patients' concerns dealt with and addressed. Otherwise, it's easy for us to fall through the cracks and not to have our voices heard. So we need to get back to that.
This was part of the core values of why the commission was started.
Exactly. So if we can get the applicant questions slide put up.
Mm-hmm. Yep.
So we are not going to go through every question in the draft. That is, they did list all of the questions that they used to pick applicants. They listed what questions they ask on the application, and those start on page 10 if you're following along in the draft. But we really wanted to just briefly mention that, again, questions 13 and 14 seem to exclude points for pain patients, advocates, and possibly the public member. And it would be advantageous to include an option for this group for these questions so that they can get points as well and maybe be chosen to be on the commission because they have the same chance at points as anyone else that's being considered. Mm-hmm. One suggestion that I had was that we represent we add something that can represent that the advocate and pain patient role in those questions. So for instance, on questions 13 and 14, instead of what it reads now, it could read, if you have a professional role in healthcare, which is already what it says, including but not limited to patient care, already says that. Here's the new part. Or you represent patients in pain, in what part of Oregon do those you serve live? So if you simply added, or you represent patients in pain, if you added that to questions 13 and 14, it could include advocates and pain patients, and it could even the score so that they were not at a disadvantage by those two questions.
Moving on in the draft report, that the commission lists the additional questions asked, page 14 through 16. We personally do not like these questions, but it is legal to ask. It's actually a bill that passed under the Oregon Health Authority's Office of Equity and Inclusion, Division 70 on race, ethnicity, language, and disability demographic data collection. So these are standard questions that the Oregon Health Authority can ask of applicants, unbelievably. And our major concern with that is it could be used in the wrong hands or used to screen, for the wrong reasons, not to help the disability community, but to actually weed out people. So that's another advocacy area we'd have to get into another time, but we did want to point that out, that actually is legal. You can see that up on the screen. We're going to link some additional links and in the private group, we're going to have some commentary possibly and some further updates. And then we're going to also put up on the screen right now the email again you're going to send your comment to and the deadline.
And remember, the deadline is July 22nd at 8 a.m. So please send your comment well in advance of the deadline. It's happened before that wires have gotten crossed and the comment hasn't been received in time, and so it's been disqualified. So please get it out there as soon as you can. We will be finishing a group letter from the Oregon Pain Action Group to the legislature and possibly the commission and any other outlet that might be helpful. And if you agree with the letter, we hope that you will support it and sign on to it. There will be more information about that in the private group posting.
Yeah.
So please refer to that group for updates. Thank you so much for your time.
Thanks, everyone. And now you can get going on your public comment and just stay tuned for the sign-on letter. Thanks so much.